Big Pharma, nicotine, a demonized molecule or a misunderstood ally? Well, smoking claims 500,000 lives a year in the U.S. alone. Nicotine itself tells a different story, one that's muddied by debate, innovation, and surprising science. From its potential to shield brains from Parkinson's and Alzheimer's to its role in sparking creativity and curbing appetite, nicotine's benefits are intriguing, yet often overshadowed by the deadly legacy of cigarettes. But what about addiction, hidden risks, or the promise of smoke-free alternatives? So buckle up. We're going to unravel the complex tapestry of nicotine use, where harm reduction meets health breakthroughs and old habits clash with new possibilities. Pam Killeen is a health and wellness coach, co-author of The Great Bird Flu Hoax, and the host of the Circadian Reboot with Pam Killeen podcast. Hey, Pam, welcome back. How are you?
Yeah. Thanks so much, Richard. It's great to be here as always. And today it's yet another very interesting subject. There are definitely many, many sides to this story. It's not as simple as saying that nicotine is dangerous and smoking increases your chances of getting cancer. If you just isolate those two subjects, so you isolate the idea that you have a delivery system like tobacco, and then you isolate the nicotine in and of itself, I think the subject that is coming up right now is more about using just straight nicotine to help with certain conditions. And the reason why it's getting more attention these days is because so many people were apparently unscathed by having COVID during the lockdowns and everything, that they noticed that the smokers didn't seem to be affected as badly as the non-smokers. So it was an interesting revelation. And so the science right now is coming forward, and there's actually some independent scientists, some what you would call street scientists, looking at this because they had successfully used nicotine to overcome what you would call long COVID. And one of the fellows who's doing a lot of looking into on the subject is a fellow by the name of Troy Roach, and he's using the research of Dr. Marco Letsky. And they have several forums. They have a Facebook forum, they have a YouTube forum, they have a page on Twitter or X. And they're getting a lot of attention. A lot of subscribers are actually going in there and offering feedback to see if the nicotine is helping them potentially with cognition, energy, sleep, performance at the gym, whatever the case may be. And I see mixed results. I can't say it's 100% effective all the time, but I know that Troy Roach did a bit of his own little study and had about 150 participants and saw that 70% of the participants felt better in some way, shape, or form using various doses of nicotine. And they do offer protocols to increase the dosage quite slowly and gradually, just in case people have reactions to it.
So let's talk a little bit about nicotine as medicine. I mean, beyond smoking cessation, could nicotine's anti-inflammatory properties, some people are saying they can be effective in dealing with ulcerative colitis, or its ability to promote tissue repair, could it justify its use in mainstream medical treatments, do you think?
We'll see about that. I think there's a lot more research that needs to be done, and they have to also consider the dark side. I worry about using any kind of medication like this because just like any drug, Richard, if you're taking a drug, what is it going to do to your naturally occurring neurotransmitters? Because the nicotine is acting upon certain neurotransmitters in the body. And so what happens when you're taking an exogenous or an outside of the body drug and you're taking it in the body? Could it be down-regulating your body's ability to produce it on its own? Melatonin is criticized for that. You know, if you take melatonin in the form of a pill, are you actually putting your body's ability to produce melatonin on its own to sleep? So could that be a result of using exogenous sources of nicotine? I would be very concerned about using it long term. But if people are very aware of the side effects and potentially maybe some kind of dependence, and I know there's conflicting views on whether or not it actually creates dependence, but if you're very self-aware and you're afraid that you could get dependent on the drug, then just tread lightly, I would say. It might be worth a try for some people based on their circumstances. But I would also say, depending on whether you're using this for energy, cognition, sleep, performance, whatever your goals are, you still need to look at a root cause issue here. I think that duct taping any health situation is unwise. I think you need to dig really, really deeply to see why you're sick or why you're feeling unwell in the first place, rather than turning to a drug like nicotine. I think health is a very complicated story, if you will, and to get to the root cause of any health complaint, you have to consider, are you sleeping properly? Are you over-exercising? Are you eating properly? Are you surrounded by EMFs? I mean, there's a lot of considerations here. So relying on nicotine for your health, I think, is not a wise choice.
Right. There are some studies showing nicotine's potential to enhance memory, as you said, attention, even protect against neurodegenerative diseases like Parkinson's, Alzheimer's. I mean, how should we weigh very quickly, last question, how do we weigh these benefits against the risks when considering nicotine as a therapeutic tool?
I think it's worth trying. I would encourage people to look at the protocols, though. I remember hearing about this years ago, and so I actually tried. I can't even remember what I tried. I bought some nicotine gum because I thought, okay, what is this hype all about? And I bought, I don't know, I don't even remember the milligrams. And I remember feeling really I felt lousy. So I gave it away to a friend of mine who smokes. And I said, if this helps you, great. But I found out after the fact, when you suggested we talk about this, I found this group called the Nicotine Test, and they talk about very gentle protocols to introduce it slowly. So if you're open to it and if you want to give it a try, and if you're sure you're checking off all the circles that you're eating well, you're sleeping well, you're not overdoing it at the gym, you're doing a lot of healthy things, you might want to give it a try and see if you can enhance, say, for example, your cognition, your energy. And if it backfires on you, just be honest with yourself. But it's not that expensive to try it. I think it might be worth a try for many, many people, but I would provide an addendum to it and say, just be careful that you don't get dependent on it, just in case.
Pam Killeen is a health and wellness coach, co-author of The Great Bird Flu Hoax, and host of the Circadian Reboot with Pam Killeen podcast, and her website is pamkilleen.com. Pam Killeen, KILLEEN.com. Pam, always a pleasure. Thank you so much.
Thanks, Richard.